Welcome back to another episode of Either End of the Table. That's Alex down there. I'm Jonathan. We're here today to talk about assessment and the importance of it. This is another really big topic in our classes, and I think that this question, probably answering this, has a never-ending discussion. So we're going to try to tackle some of it for you. I think that Alex and I, again, have pretty similar thoughts, but we're going to try to bat it around a little bit and get some different points across to you. So, why does assessment matter? I mean, I think a lot of times, Alex and I feel so strongly about it. It's in the sense of, if you're not willing to assess, then you shouldn't be putting your hands on anybody. And if you're not assessing, what the hell are you doing in your sessions? And I know that sounds, again, a little aggressive, but we're going to tone it down from there, even though it is, do some assessment. It makes a difference in your sessions, right?
Yeah, and I feel like one of the, there's always a lot of students at our workshops that, we're filming in my studio, and it's a pretty generously sized space. I'm blessed to have it, and I worked hard to make it a thing.
He did.
And so I've got a little bit of space that I can have people walk back and forth. I can close blinds and keep it all private and everything like that. But a lot of people are working at chiropractic offices where they have tiny little rooms.
Yeah.
Like doing a gait assessment may not be an option.
Yeah.
Clients may not be comfortable changing down to workout clothes so you can see the posture of the spine or the hips or whatever relationship they need to see. They may be sold on the idea of assessment, but how do we actually do the assessment? How do we incorporate that? So I feel like there's like the two parts. It's like the assessment matters.
Yep.
And then how do you do it? How do you actually start incorporating it into sessions?
Right.
And similar to when we were talking about where do you start for sessions? I think in some ways the message is kind of the same for assessment. Start somewhere. Start with something. When we're looking at assessment, we're looking at posture. Typically, but not exclusively.
Yep.
Gait also reveals a lot.
Yep.
And then range of motion. How somebody even lays on the table, whatever the proper way of saying that is.
Lie them on the table. They lay on the table.
Thank you.
Little grammar lesson for you all. We're making these worth your time.
Exactly. It's not just body work we're addressing in these videos.
Yeah, Alex, I think we talk about this an awful lot in the sense of, as Alex just ran down that list, but I'm also sort of reminded here in the sense of, okay, clients are resistant to this, Jonathan. Clients don't want to spend their time in assessment. They just want to be on the table and getting work right away. And I can't say enough to all of you that assessment time, even if it's small, even if it's 5 minutes of time, even if it's micro assessments of how someone walked into your office or how they're sitting in their chair or how they describe what it is that's hurting them or the problem, that those things start to add up into a bigger picture. And ultimately, even on the table, listen, range of motion is still possible, but you can look at how somebody is on the table, face up, face down. Boy, their hip rotates this way. They're not comfortable with their arm in this position. Those things start to add up in that fashion, and I think that we don't really think of them because they don't seem like formal assessments where I'm checking the boxes for this is moderate, this is severe, this doesn't. But it all matters. So if you can convey that idea and tell your client, hey, if you give me just 5 minutes, the actual work I do on the table will be more impactful, be more efficient, and there'll be less fumbling around for me trying to figure out what's going on in the moment. I will already have a plan as we get you to the table. And for most of you, again, as Alex just mentioned, it's sort of out of that same where you start a session. Oh, I formulated a plan through my assessment for today's work. So that's just one of the big reasons it matters.
Yeah, I typically do an hour of body work with my clients. 75 minutes on site. That gives us time for
thank you.
Checking in. You do a similar kind of thing.
Yeah. Yep.
And There are definitely times when I'm really pushing the envelope because we get halfway through the session, we realize, oh, the issue is not here, it's actually over here, and in order to resolve this, we may end up pushing the session out. But there's also times on the other end where I may spend 15 or 20 minutes actually continuing to do either posture assessment, history, talking about how the injury happened, or even just gait assessment. Before we even get on the table. And it's essential, because that 15 minutes of assessment makes the 45 minutes I have with them really, really efficient, because I can find the things that need the work. And that brings me to the other point, because I feel I wanted to really hammer this home too, because this is a two-part. This is really kind of a two-parter. We're mashing together. And with the issue of why assessment, and it's really, for me, it boils down to that mindset that the body will always find the most efficient way to do something given the situation it's in. We've got old injuries, et cetera. People often are critical, I think, of the body sometimes. And I don't, why does it not function right? Why am I in pain? Why is it treating me like this? And it's, I look at it from years of doing body work as, it's amazing that with everything you've had going on, that you're still getting one foot in front of the other every single day, that you manage to ambulate into this room of your own accord without any, additional help or anything like that. And that's because the how the body is able to manage all these things. And I see our role as therapists as finding what the obstacles are to a client finding a more comfortable range, or to getting back some movement in the hip, so that hip starts moving again, then the rib cage can start moving again. Getting the rib cage to lift so that the neck isn't being pulled forward too much. Our goal is to find the block, find where the client isn't able to move and fully express into that part of their body. And so So we can talk to them about their experience in their body, and that's really important.
It is.
To get the history, figure out what's going on, what brought them in, where do we need to go with getting them better. But really the path of how we get to that point where we can say, all right, we're at maintenance now, call me when you need me, or check back in 2 or 3 months, and we'll just keep maintaining what we need to maintain for you. It's all about figuring out where they're not moving well. And posture is one way, because when things are tight, we will tilt and shift and bend and twist into that and away from it. Gait is always a really helpful thing, because it shows how they move. And as a little tangent into the gait assessment, it's one of these things that is hard to incorporate into a setting, especially if you're in a small setting.
Tiny office.
Even in my space here, I'm limited. A client gets maybe 5 or 6 steps. It's like they just hit their rhythm, and they got to stop and turn around and go back. There are definitely times when when the client will just arrive, I'm like, you know what?
We're gonna,
we're actually gonna head out to the street. We're gonna go down to the sidewalk and just have you walk to the end of the block and back a couple times. And just doing that, you're seeing people walk in a more natural environment. And you can see the full expression of their gait, and you can see, is it the hip? Is it the rib cage? Even if you can't see the specific, line of how this leads to this, leads to this, leads to this, if you can at least see that the hip isn't fully articulating or swaying on both sides, it gives you a place to start.
I mean, I'm going to say the same thing, but I'm going to apply it to posture, because we talk about this a lot. Most people, when you look at posture, they automatically assume, okay, I'm under the microscope, and they go, and perfect posture. And I start dialoguing with them in their intake there, and let them relax a little bit and swing in, because a couple years back, I think Alex and I almost started saying this at the same time, or maybe one of us, our job is to decompensate our clients' lives. And in that process of decompensation, we need to recognize how they're moving, and what Alex said is how they're not moving. So whatever it is in that sense, and another one that sort of came to me in that discussion too, one of the things that I am regularly looking at in my sessions. I think maybe even more and more lately. It may just be the issues that I've been seeing in people, but watching people's breathing patterns on the table has become more focused for me for some reason. And that isn't just, are you taking a deep breath or short breath? I'm like, oh, the right side of the rib cage seems to be really filling up, or this client actually moves their leg at the bottom of this to breathe. And so I again, it's one of those things where I'm super curious about and trying to follow that little trail of breadcrumbs to wherever it may lead me on their behalf. So assessment, again, I'm never ever going to tell you that it's not crucial, but at the same time, we don't want people feeling guilty for, I do 15-minute sessions with chiropractors. Most of my clients are really resistant to this. We just want you to feel like there are tools for you to help support you, from you, by you during your sessions. And assessment is that big tool, Yeah. So I think maybe the only other thing in terms of thinking about what the next, as Alex was sort of saying, there are the two steps of it. Okay, I did all this assessment. Now what does it mean? Mm-hmm. We're back to one of our other podcasts earlier. It means you're going to pick a place to start that session and work out from there based on that assessment, and hopefully start to make change, because that's what we're here. That's what we're doing. We're decompensating our clients' lives. So start that process.
Well, before you wrap it up, I do.
Oh, you got it. Alex is going to interject one more thing here.
One quick final thought. It's like, okay, gait. You can't do gait. You can't do posture for whatever reasons. You always have your time at the table, and I feel like so many people just start running through their routine, the things they do. We get really wrapped up into how we release different areas. Or maybe just the flow that we have of doing with the back, and whatever it is it might be. Every time you touch structure, you're intervening on it, you're assessing it, you're feeling what's going on in that tissue. You're starting to learn about the years that tissue may have been held. If it, the fascia has a certain thickness, a certain consistency when it's been building and scaffolding itself for years. Versus if it's just, a tight muscle from a hard workout yesterday. Like, it feels different.
Yeah.
And you can tell from how it releases underneath your hands or your elbows.
Yeah, or whatever tool you may be.
But that body mechanics is a different podcast.
Yeah, so we'll bring into that one later.
But you can tell from how the tissue releases underneath you that, you have created some change. How is this, once that releases, then where's the next step? It's hard to I guess to describe that without being at the table, seeing it happen while I'm demonstrating on somebody. Okay, this tissue is released. Now I'm moving on. Now I notice this other thing is tight here. In that there's never a protocoled flow. There may be an overall body map that I want to get to in this session, but there's never necessarily a protocoled flow of this step leads to this step, leads to this step, without ever a sense of mindfulness about what I'm doing and how I'm doing it, and how is the client reacting to it. So I just want to send that message out there that it's not just about posture, gait, range of motion. It's about every single time you touch structure and you intervene in it, you are making a change in that structure. And to be attentive to that, because I think there's a lot more that's going on in the work that people are doing than they realize. Yeah, I mean,
I'm so glad Alex didn't let me stop, because not only was that an excellent point, but I think in sort of trying to summarize a little bit of it, assessment just never stops. Assessment and body work are simultaneous. They're two sides of the same coin and happening. And if we're in tissue, we're assessing what that tissue's all about. And Alex gave two really great examples, so I won't go too far, but the sense that there's probably no moment in my session when I'm not really assessing either how the rest of the body's responding, how the tissue's responding, or a number of other different things that are going on. So if you're paying attention and you're invested in that way, then everything that Alex just put in there really does matter. So awesome. Way to make sure that we finished that out without, because we would have lost that. I think I would have cut us off right there because I thought we were done. So that was a good little addition. And yeah, no, he definitely. That's why I keep him around.
And I keep him around for the grammar.
Yeah, exactly. So hey, right. So that's where now we are going to officially wrap this one up on assessment.
Hope you found it helpful. Like and subscribe. Check back in with us, and
stay integrated.